Good morning, guys. My name is Dr. Rob Kelly, the Addiction Doctor, along with Jennifer Lovely. This is the Recovery Channel podcast. Good morning to our Facebook friends, and my goodness, we're already hitting numbers, and our YouTube friends coming live, and we're going to head up to a bunch of podcast sites this evening. Hope you're having a great day. Live from San Antonio, I am, and Jennifer's not live from where she usually is, but she's live from...
I'm live from Sedona, Arizona this morning, so that is exciting. You know how much I love this place.
I know. Beautiful, absolutely. What we'll have to do is, you came down here a couple of weeks ago, we're going to have to come over there while you are for like a long weekend or something. We might we'll get the plane out. For short journeys, we're good. For long journeys, it's like 20 grand just to get out and pilots pay and shit. So might have a quick fly over there, hopefully. Hope everyone is doing well, guys. We're going to be talking to Jeremy Fox today. I was on his podcast a couple of weeks ago. Absolutely awesome guy. He's a specialist on trauma work, which kind of is the center of any recovery program. And something that we didn't really discover a month or years ago was the trauma. I mean, we looked at the alcohol, we looked at the childhood stuff, we looked at the drugs, we looked at the behavior, depression, stuff like that. But we kind of forgot about trauma because we really knew little about it. It's like, when you talk about trauma, we have to define trauma. Because when I say to people sometimes, you're suffering from childhood trauma, they go, oh, no, Dr. Rob, there's no way. They go, well, let's take you back. Let's define trauma. With the addicted brain or the depressed brain or the alcoholic brain, anything less than nurturing is child abuse. It's just simple as that. Let me give you some examples. Mom says to you one day, get down off that chair, you stupid idiot. How many times have I told you? No, you can't go to college like your brother. You're not clever enough. It's childhood trauma. That stuck in my head for years and years. And I'm an alcoholic. So what did I do? Went to the best university in the world. Bought the best car in the world, best house. It just all goes back to that, being a stupid idiot and not being good enough that I was told. And I kept hold of that for years and years and years. And it was only through... Come on, Jen.
Oh, well, I was just going to say, then the other thing about that is that we continue to recreate it in our life. Later on,
without a doubt, he's come back and back and back. And I can only speak as an alcoholic, but it's not the alcohol that kills us. It's the trauma, that turns into selfishness because we isolate. That's what kills us. Nowhere does it say that the alcohol kills us. It's just the end. It's the end result. It's the symptom. It's going back. Let's clear the trauma. We have a saying here: back to the scene of the crime. Yeah, because that's about sums it all. Where was the crime? Oh, my God, was trauma the crime? Of course it was. Why can't I stop doing X, Y, and Z? Because of the trauma.
Right.
And I know there's a great few guys. I went to the Meadows. It's kind of not a secret, but I did go to the Meadows about 2 or 3 years ago because I had a breakdown, psychological breakdown, because I was working too much and there's a lot of stuff happening. So I was diagnosed as PTSD and I was sent to the Meadows, probably one of the best places in the world, apparently very expensive, no insurance. But it's the best thing I ever did, EMDR and somatic experience, and was just absolutely phenomenal for me. And I know Jeremy Fox is a specialist in EMDR, so we're going to get his take on it. So this should be a good one, Jen. I'm looking forward to it.
Me too, especially since I have spent a lot of time doing EMDR.
Excellent. Love it. You'll see I'll get on like a house on fire, no doubt. Guys, once again, thank you for joining us. This is the Recovery Channel podcast. Myself, Dr. Rob Kelly, the Addiction Doctor, and Jennifer Lovely. A lot of new stuff coming, by the way, guys. I'm going to give you a little teaser at the end of the show, but for now, hang around for 10 seconds. Jeremy Fox is with us this morning. Good morning, guys. Welcome back to the show. If you just joined us, this is the Recovery Channel podcast. Myself, Dr. Rob Kelly, the Addiction Doctor, and my partner in crime, Jennifer Lovely. Jeremy Fox is on the show. Good morning, Jeremy. How are you doing?
Doing pretty well. I have to say, I really love the intro teasers, the surfer. It's very edgy. I love it.
Very professional, this show. I go into other podcasts and it's just like two guys talking and they're like, but this is focused on the radio show that will be eventually turned into, which will be syndicated on Sirius Radio. So we're trying to get all our ducks in a row, make it as professional as possible, because who better than me and Jen to do this shit?
Yes.
That's all I'm saying.
So how's it going, Jeremy?
It's going pretty well. How are you guys today? I loved the intro conversation.
Yeah. So let's just jump in because I'm a person that loves to talk about trauma. I'm a person that wants to splay open the wound, dissect it, feel it, and then gently put it back together neatly so that we can, so that it's not continuing to hurt us. I was diagnosed with complex PTSD some years ago through my own childhood trauma. And when they said that to me, I was like, well, first off, I was like, what, really? And then second, I was like, well, I'm kind of special because I have complex PTSD. It made me feel kind of, my addicted brain wanted to be like, oh, I'm special. Even though we're not. So
it's a good reframe. It's a great way to look at
it. So let's talk a little bit about what trauma is. How do you define trauma?
Absolutely. So I heard you guys talking about that a little bit. So the APA defines trauma as an emotional response to a terrible event. And so that's kind of like an accident, sexual assault, or natural disaster. So that kind of scratches the surface on it a little bit. I mean, that's from the American Psychological Association. So that's where I'm taking it from. But let's go a little bit deeper and let me get to the neurobiology of trauma, okay? Because that's really where you're going to be able to tease apart what it actually is. So whenever you have an event that's too intense and encodes in your brain in a somatic way that later on a reminder, what we call a cue reminder, CUE, something that cues up a physical response, that's going to be trauma. So it can be like what Dr. Kelly was saying, when you get a really aggressive comment from a parent and it just knocks you, and when something reminds you of it and you feel that in your chest layer. When you get anything in early childhood, especially, the threshold is lower for what can become trauma, meaning when we're kids, we're really defenseless. We imprint things more. We take it more personally. And so I would define trauma as anything that on a developmental level, when it hits you again, when you get reminded of it, you feel younger again in a defenseless way, or you have a vivid negative emotional reaction.
So when we talk about trauma itself, I know we know little at the moment still. It's only the last 10, 20 years that they've gone into trauma. Do you think there's still a lot we don't know regarding the damage that it does as we grow older, or do you think we know everything by now?
That's a great question. I think we don't know. What we do know is that traumatic memories are processed more heavily by the amygdala, which is that almond-shaped emotion center deep subcortical, meaning within our cortex in our brain. So we're learning about the structures that process and create trauma. So that's, as you said, within the last 20 years, it's been huge. A huge amount of research has come out showing how traumatic memories are different. I think the impact of that economically is something we're beginning to see. We're beginning to see how it takes away from productivity, how it takes away from people's actual quality of life. As far as how to redo that, therapies like EMDR are huge. And I think part of the problem is we're not getting the message out there enough. You're not getting the signal through the noise. So I would even say we know so much and there's so much cause for optimism, but you're not hearing about a lot of traumatically helpful therapies that overcome it as much as you're hearing about stuff that maybe doesn't work. So I think we as therapists have to up our game and teach people about somatic experiencing, EMDR, as you do, Dr. Kelly. You always spread the word about that, and you, Jennifer. I think we just have to be better on point with messaging.
Well, I think people are just getting to the place where they can actually talk about it in a way that feels safe and comfortable. Because in the old days, you brought up the word trauma and people would be like, oh no, we're not having that conversation. That's too much for me. This is not a dinner conversation, right? And it is. We can talk about the traumas now. I feel like it's a more open conversation. Go ahead, Jeremy. You were going to respond.
Oh, no, I was just going to say, I deal with this a lot, and my approach to therapy is very authentic. That's why Dr. Kelly and I really meshed well on our podcast, is because it's really no nonsense. I mean, what you consider trauma has to expand. So again, that definition of anything that really produces later a negative knee-jerk emotional emotional reaction, that expands how we look at it from things like just sexual assault, which is horrific, and wartime trauma, into things like chronic neglect. One thing I really would love to hit on is that we're in a huge neglect epidemic when it comes to the way people interact with their kids, and what we're seeing on a cultural level of just disengagement. And neglect is as damaging as trauma long term. Not having stimuli, not being engaged with as a kid. I mean, if anyone wants to Google or look at the Russian orphanage studies or things that show what it looks like to have a neglected brain, you'll be surprised. That's a huge issue now. So even that fits in the definition of trauma.
Yeah. And the important thing is to look at for the future, while we're talking about the future, is remember at school years ago, and you could, the guy that went in and shut the schools up, you know, that guy, you trace his behavior for the last 2 or 3 years, and it's the isolation. It's the guy in the corner that nobody takes any notice. So it's the invisible guy that nobody really talks to. Everybody's invisible today. Everybody's on the phone. You know, we have a couple of guys that come on. Hey, do you know something, Rob? I'm not lonely. I've got 5,000 friends on Facebook. Like, hey, dude, you're plugged into the fucking wall. That's all you're doing. You know, right. When you walk around your phones all day, it's the same guy in the corner isolating. And one of these days, when you come face to face with reality, you're either going to be able to cope with it or you're not. And the epidemic that we've come in, and it's happened now, 2020 going on to 2030 probably. We got to be careful, guys. And like Jeremy says, we've got to step our game up because, you know, it's just not good enough. The thing I like about some of the wars we've had, especially Afghanistan, is not the war itself, but the identification and raised platform of PTSD, which has got us into trauma. Before trauma, I don't know about you guys, but before I didn't really hear about trauma. It's like the soldiers coming back, and then we looked at them, and then we realized that that wasn't the only trauma that can cause, even though it was absolutely horrible. The young brain, just as horrible when you get slapped and put in a corner or in a little room and locked in as it was going to war, would you believe? Would you agree, Jeremy?
Yes, that when people are abused as children, it's just as bad as that, as wartime stuff.
Yes, for sure.
Yeah, I would absolutely agree that early, I mean, a lot of what we're looking at now, and this is something else people can check out, is the Adverse Childhood Experiences Scale, ACEs.
Yeah.
I'm sure you guys have heard of that before. That, and so Jennifer, getting to what you were talking about complex PTSD, the more yeses you answer to questions on the Adverse Childhood Experiences Scale, the greater the prognosis of complex PTSD. So complex PTSD, for people out there, is a function of early childhood abuse, typically. So repeated and early. Those are the two things, to make a clickbait kind of title about it, like the two things that predict complex PTSD. It's going to be early and often trauma. Early and frequent trauma. So I would absolutely say that what we know about how that affects the brain and how that depletes resting levels of cortisol, and how it contributes to when people are stressed, a greater release of cortisol in that moment. We know that these things are happening on a neurobiological level. And so one great thing out of studying trauma now is we do know that early childhood abuse is as impactful as like wartime experience as an adult. Now, not to take away at all from veterans, but to say, actually, we know that this level of traumatic kind of stimuli matters.
Yeah. And, you know, the thing is like, you just, you know, so many people are like, well, you know, you need to get over it. Like, I mean, so many of Dr. Rob and I's clients will come to us and say, well, Jen, look, I didn't really have that trauma. And people just tell me to get over it. And what I want them to understand is, like, for me, I could not absorb information. My PTSD was so intense that I literally could not absorb information. I remember being in a training and the teacher was like, Jen, I really think you have PTSD because you're not absorbing the material. And I kind of brushed it off. And it wasn't until like a couple of years later that I was, oh yeah. And it started coming up and I wasn't ready. My brain wasn't ready to process all of the trauma at the time. And I really, and fast forward into this day where we are right now, we're in the middle of a pandemic. We're in the middle of a trauma experience for a lot of people by isolation. And I posted something yesterday around the amount of overdoses and how we don't even realize, probably it's going to be 2 or 3 years, the after effects of what COVID is actually doing to us at this particular time by not being able to, interact. We're a species that needs its people. Do you want to speak to that, Jeremy?
Absolutely. A lot to unpack there. I would say that it's possible. No, it's in a good way. It's possible to acknowledge the need to stay safe in a pandemic and also to be authentic about the fact that isolation causes trauma. It's a form of neglect, right? I was just talking about that. So we have to be intentional about connecting with people. We have to be more intentional than ever about taking care of our mental hygiene. So one of the big things to keep in mind is as Dr. Kelly said, counting your social connections by your connections on Facebook is completely unhelpful. And there isn't, unless you're interacting with those people visually on a level that is interpersonal, you're not getting any socialization from that. And so we really know that the incidents of trauma and addiction go hand in hand. People, when they are feeling isolated and alone, will often turn to substances. And so that addictive thinking starts before a substance is ever picked up. And it really does. And so what we have to do is, as therapists, be out there educating and explaining that there are alternative pathways to dealing with the urge to feel something, right? Because at its core right now, what people are dealing with is this kind of stir crazy isolation. And they're trying to turn anything to moderate their feelings and to change them and elevate it. And so what we have to do is divert that from substance use into exercise, interacting with others, doing fun things, mindfulness, a bit at a time, each small victory compounding instead of people sinking into depression.
I love that. Absolutely love it. Guys, Jeremy Fox is on the show. We'll be right back after a quick word from our sponsors. Hey guys, welcome back to the show. For those people who are just listening on podcast, that was Life Over Addiction. This is Lance Wright. He's a transformational life coach. Let me help you navigate your life's path back to the one of purpose and meaning. He says, the chains of shame and guilt no longer have to hold you back. Let's start a new conversation, says Lance. LifeOverAddiction.com or info@lifeoveraddiction.com. Why not call in instead? 310-890-2337. That's Lance, such a great guy. Jeremy was talking before about isolation. And I know we did some studies that when we first came over here, we were allowed to do some studies on a couple of prisons and jails. And we found out a couple of things. First of all, we found out that probably 80% of people on death row have no idea what they did at the time. They was under some kind of influence or trauma. But secondly, that a lot of people go insane because, you get sentenced to death on death row and 10 years time, you're still waiting to go. But the isolation is what gets them. And more people go insane waiting for the execution. Do you reckon that's true? I mean, have you seen that in practice? I mean, surely the isolation's the same in a one-bedroom apartment with no family than it is on death row.
Such a great question. Absolutely, isolation is something that I've seen really be a detriment to people's mental health because they have time to spin their wheels mentally and obsess and ruminate over things. So one of the symptoms of PTSD is rumination. Okay. So there's all kinds of different symptoms to PTSD. There's the avoidance symptoms of avoiding the stressors that can cause you to have a sort of a flashback, and that can lead people to some agoraphobic behavior of avoiding everything and staying away. And there's the reliving symptoms of ruminating on past events, of having flashbacks or dreams. And so when you have someone isolated and in their own mind and always thinking about previous things and potentially different triggers, it's an unhelpful thought process. It can solidify kind of the belief that they're broken. When you're not putting in new experiences, you're dwelling on old bad ones. And I also want to hit on what Jennifer was saying about not being able to retain new information. So for listeners, one of the biggest things that you can do is consider, like if you have ADHD, if you have an ADHD diagnosis or believe that you have it, talk to your doctor or therapist if you've had any trauma before, because there's a very good chance that there's some anxiety or trauma causing attention issues. That gets misdiagnosed often. And that's huge. Is your brain too anxious to retain information? Well, we've got a cortisol flow going of that chemical in our body. Our brains are not in an optimal state of learning. When we're stressed out, our number one priority is survival, not retaining the finer points of geography, right? Not retaining new information. We've got to survive. So that's another thing I want to drop on the audience.
Well, and that, to speak on that, like that's one of the things that why it's so important for, and it's our teachers are not therapists, but it's important for them to be doing the ACE questionnaire. Yeah, because if they can catch that early, that there's something going on with our children, then from an early age we can get the help that we need. And when I was in school, nobody even considered that there was trauma, and my mom was a school teacher, so we weren't going to mess with that, right? We weren't going to have that conversation. And nobody actually reached out and said, gosh, something's going on here. They just, as a matter of fact, my second grade teacher just said, she's just not going to really grow up to amount to anything. Right?
Wow.
I know, right. And it was because my brain could not absorb anything. It's fascinating. Yeah,
it absolutely is. And it's morbidly fascinating, because that just goes to the point that the adults who, I would say are well-intentioned, many of them, it's definitely not well-intentioned to say you're not going to grow up to amount to anything, number one. So that's not even from a place of trying to help, but misguided. It's totally inaccurate. I think we're walking a line here where anyone who works with children or developing minds is going to need some education, no matter how rudimentary or basic, in the impact of trauma. And everyone can't have in-depth conversations about it. Everyone's not going to be a trauma specialist, but they can understand some of the root causes of it and who to hand that off to, right? That sometimes might have to be where it goes. And there's so many great guidance counselors in school settings that teachers can kind of flag different students' experiences and maybe, encourage them to go to those counselors, that they can work hand in hand together to ensure that those kids, have a better experience at school than what you're describing.
Right.
I know as well, when I look back now, when I go to counselors, because we try and check counselors out, poor guys are teaching from manuals and textbooks from the 50s and 60s. So the modules are still around and haven't been changed. Now, we know through about 10 years ago, we found out that the brain was plastic. Neuroplasticity is what I specialize in, that we can find out that we can redirect neural pathways to stay away from trauma, which is awesome. But we only found out that 10 years ago. So my question to you, Jeremy, is in 1987, I think Shapiro invented EMDR, and it was to cope with an overwhelming stress and trauma and creation of PTSD. Let's talk about EDMR. I know you're a practitioner and you're qualified to use it in your practice, but exactly what is it? Explain what it is to our viewers.
Absolutely. So EMDR stands for eye movement desensitization and reprocessing. It's a mouthful. You have to repeat it a few times before you get it, but it is a therapy that uses dual attention stimulus to reintegrate traumatic memories. So, for an example, let's say someone has a memory of a car crash, and when they're driving and they see something that reminds them of that crash, like someone's too close on them, they're riding them, they tense up and have those somatic reactions like they're in the moment. Okay. Obviously that's very dangerous. And so I've dealt with people who have those kind of single episode traumas, using kind of a simple single episode example here. So typically what happens in a traumatic memory is it's encoded in a very somatic, procedural form that when it gets triggered by a cue in the environment, you feel like you're living it. So what EMDR does is help to change that memory. It helps to put that memory in episodic form of, oh, that happened, now I'm over it, rather than it's happening now. And so it's very interesting. There's a few different theoretical models for how it works. One of the ones that has some great research behind it is the working memory hypothesis, which if you imagine like a computer has bandwidth, like your Wi-Fi, and when you stretch it thin, kind of causes things to slow down. The eye movement in EMDR, which is typically bilateral, just meaning side to side, gives your brain a distracting stimulus to focus on, while in the therapist's office, and that's very important, you're dealing with a trained professional, while you're noticing the trauma. So what that does is it distracts your brain enough that it resets your hippocampal memory center theta waves while you're receiving that stimulus, so that your brain can digest and metabolize that memory that you're bringing up in a less upsetting form. You're re-encoding the memory as something in the past and not that's happening in the present. So hopefully that makes sense and is a good little scientific definition that also makes sense.
Sorry, Jen, let me ask one more question, because experience and EMDR has something. I mean, somatic experience was also hand in hand with EMDR.
Yes.
Born in the 70s with Peter Levine. I was trained under Peter Levine. And here's an example. A great example is we look at animals to see how they get over stress. So when you see a deer or something get hit by a car but not killed, the first thing it does is jumps up and it shakes violently. And by shaking violently, it gets rid of all that PTSD or trauma or stress that the animal is going to get on later. And we learned a lot about that is during the time of the stress. If we even can do that, it releases all the muscles and you'll be able to deal with it a lot better than you do that if you just went, oh my God, that's such a bad accident. Oh my God, bang. Like Jeremy just said, the brain's off, it's encoded. And unless you seek help, it's going to come back and bite you on the ass. So have you experienced somatic experience, Jeremy?
Sorry, you broke up there. What?
Have you experienced somatic experience?
I have not undergone the therapy, no, but I actually have studied it and used interventions with clients. And it's amazing. The crux of that theory is that stressful situations produce survival actions, right? And if they're interrupted, we get these vivid procedural memories that show up as traumatic intrusions. So if our reaction to trauma, and this is a huge element of trauma, by the way, it is usually a function of being immobilized during a terrifying stressor. And so if we can't move and express or shake out a reaction to a traumatic event, the prognosis for getting PTSD is much higher. So I love somatic experiencing. Sometimes during EMDR, clients will say, I'm getting this urge to move, to do this, to punch. I'm like, do it. Do that while you're moving your eyes here. Let's get that. Let's integrate that desire for completion. That's a big part of trauma. And I've written about that for the EMDR Journal of Research, that's published by the International EMDR Organization. The desire to complete whatever you feel was stunted during trauma is a huge thing that EMDR allows us to do, and somatic experiencing, which they're both so amazing. They're probably my two favorite therapeutic modalities.
Well, it's interesting. So I teach 12-step yoga. And the way that, if you don't know Nikki Myers she's also a somatic teacher, yoga teacher. She's also a recovering addict. But what she talks about is that first we have a meeting and we do like a 12-step meeting, and then we move our body, because then after the meeting it integrates into our body, and then our brain and our body can actually reintegrate and actually feel safe. It's the shaking, as Dr. Rob was just speaking of. It's the shaking experience. We're moving our issues that live inside of our tissues out. And so I really believe that makes a huge difference in just allowing people to share and then move their body. It makes all the difference. And even when I do a lot of, ACA work, inner child work. I'm a big family systems person. And after we do the inner child work, I actually have them sniff something sweet like a peach or something, and then do jumping jacks or push-ups, because it then integrates into their system. And so Dr. Rob and I have a client recently that was like the most amazing success story of being able to get off crack cocaine and doing his inner child work as well as the 12-step, and how we both integrated both of our work. And I wish I could just tell you, it's been like the most profound experience on this end. Watch that healing occur. I know I'm sure you have clients that are profoundly healed in that way. And by doing both that integration, I think it makes all the difference in the world. So talk to me a little bit about how when a client comes to you with their trauma or a trauma, do you immediately go into EMDR, or are you working with them, speaking directly with them just through talk therapy, cognitive behavioral?
I'm really glad you asked that. Yeah, I am absolutely pleased that you asked that, because I take for granted, I've been talking about EMDR so much now that I take for granted what people may know and may not know. So I really want to hammer this home for everyone out there who's maybe afraid to get into therapy because you feel that you're going to be made to relive your trauma right away. If you find someone who's very well trained in EMDR, who is either certified or a consultant in training, that person's going to be way less likely to make those kind of mistakes that push you too quickly, because that's re-traumatizing, right? The whole reason you want to get trauma treatment is because you experienced something that was too intense too early on in life, or in an inappropriate context. So no, absolutely not. We don't jump right into EMDR. We do the kind of things you were just talking about, what we call grounding exercises, right? So things like smell is our most rooted sense to memory. Smell and memory are highly correlated. So if you have a good smell that you have someone enjoy, it sends them into a positive mental space, right? So it makes total sense that you have people do that. That's a very empirically founded grounding technique that helps people to be aware of their present surroundings. So what we do with EMDR is we first engage in these kinds of exercises to teach people, okay, I can be safe, I'm here. We do what's called the preparation phase. And we have people, after we treatment plan, we have them begin to learn techniques for mindfulness of, okay, one of them's called calm place or safe space. It's very much what it sounds like. Or we also have the containment exercise, where we have people imagine taking their previous some kind of stressor and put it in a literal container, right? So we do these things to strengthen that muscle for mindfulness and for present focus. And so we do that first. We ensure that people can do that before we jump into the work of reliving, because you have to feel the memory to heal the memory with EMDR. That's a big rhyme that we use. So we want to make sure that people can press that escape button mentally and get out and not be stuck in that memory when we're working on it.
Yeah. Beautiful. I love that. Guys, Jeremy Fox is on the show. Another word from our sponsor, and we will be right back. Welcome back, guys. Living Recovery Interventions was the commercial just played. If you listen on podcast only, recovery begins today. Recovery begins together. Give the gift of recovery. Travis is a well-known interventionist, absolutely an amazing guy. I love his story from a Xanax seizure to a car crash, 120 miles an hour. If a loved one is suffering or is in trouble, guys, call Travis on 801-573-4188. That's 801-573-4188. Go to his website, which is livingrecoveryinterventions.com. And remember, guys, recovery begins today. Recovery begins together. So I know we talked about the amygdala that sends a distress signal to the hypothalamus, which then sends another message to the sympathetic nerve system. So, which is awesome if you know about that. But what else are we struggling to understand, Jeremy, with the brain regarding new science? I mean, is there anything else, or is EDMR and SE? Is that it?
No, that's a great question. So I think what we are looking to understand more now is the idea of passing trauma on an epigenetic level. So the idea of generational trauma, that is a huge field that we could go down the rabbit hole on, of people who experience trauma in their life, kind of passing that on. And I don't want to alarm listeners, because the key point here is that EMDR and other therapies can do a great job of reversing that and putting and even restoring at some point white matter in the brain. There's some amazing articles about neurogenesis, as you were talking about neuroplasticity. But I think on that genetic level of stress resulting in stuff that then carries on, that's the big frontier now that we're looking at, is how to cut that off, how to nip that before it continues forward.
And, that's the thing. How do you? Because the truth is that, for me, I'm going to stop the generational trauma. I'm going to be the one that talks about it. I'm going to be the one that makes everybody else uncomfortable in my family and discuss the things so that it doesn't continue. I have a granddaughter now. The last thing I want is for her to re-experience similar trauma. And that requires something of us. That requires us to do something about the trauma. And so can you speak to what it is to come in and be the one in the generation to say, the buck stops here?
Yeah, absolutely can, because many of my clients that I've had are just like you, in that they want to be the link that breaks off from that trauma chain, right? And that's such a noteworthy and commendable thing. It's beautiful. And the great part about that is I'm not just blowing smoke. I don't do that. That's not my thing. You can be that person to stop that. And one of the biggest things that you want to do is you want to determine what kind of attachment style you have and what gets you linked or hooked into traumatic relationships or situations. Not to victim blame at all. In fact, to empower people to go from being victim to survivor and say, what are these situations or triggers that I want to avoid? Do I have chronic insecurity and feel like I need to earn people's approval and get in situations that are detrimental for me? What can I do to map out my history so that it doesn't become my future? So a big thing you can do is determine what kind of things set off your anxiety response. We call those trauma triggers. Go to someone and get EMDR for it. Learn to breathe through those triggers when you think of them in your brain, obviously with a professional or in a safe setting. And you will rewire that response. You will retrain your brain that you don't have to endorse the same sort of thinking, and your body will actually change at a level where you're not reacting the same way. So it's not just about positive thinking. That's great. And I like CBT and those other therapies, but I will say, changing how you respond to things or even how you self-soothe will result in changing your emotional responses. And that trauma is all about emotion. That's why just telling someone to calm down never works. It's because what you're doing is you're basically applying a verbal solution to an emotional problem, and it just doesn't work that way. So you have to be, as a provider, really versed in somatic means, in stuff that's pre-verbal, that does it before it even gets to your mouth, the sort of feelings you have with trauma. So first of all, determine your attachment triggers, your trauma triggers. Just the fact that you're being authentic and open with it and telling your kids and wanting to explain what trauma is going to be a huge protective factor, because people can't look out for what they don't know is a danger. Everyone teaches their kids not to put their hand in the stove. How many people tell their kids when to walk away from an abusive individual, right?
Right.
Just doing it is going to be protective.
Right.
And that's ingrained as well when you know, we're not taught these things. We're not, like Jennifer was telling me before, stuff it under the carpet. Let's not. I mean, I got told to lie at an early age. If somebody calls on the phone, don't tell her our real address, because we live in the terrible part of town. Tell them that we live around the corner at the posh houses. Then I was taught how to lie at an early age. So I became a pathological liar when alcoholism stuck in. And the worst person to read, for me anyway, when I do my work, is a pathological liar, because they believe the shit that they're telling, which goes back again to the brain. And I'm so glad that today we know that, you know, we can redirect the neural pathways. It doesn't always have to end, because when trauma is in full-blown flight, it's called self-sabotage. That's all we're doing. We receive it, we flash back, we want to kill ourselves, we want to drink, we want to, whatever it is, it's always the same. And the knowledge of what we know today. I mean, I'm adamant at you need to find the right person. Do you think we had the couple that Jennifer was talking about, a crack addict, okay, with a wife that had a terrible past and she was an alcoholic. To mend that relationship, and we're brave enough to say permanently, you need to know what you're doing, what you're talking about. And I think today, when you go and see a therapist, you need to start asking questions, because many people just go, "Oh well, I've been given a therapist by my doctor." Stop. This is your life we're talking about. How do you know that guy's qualified to take you through what you're going through? Now, if you want a pill or anything, psychiatrist will take care of that. If you want someone to have a cup of tea with and go there, there's a bunch of therapists out there to do that. But which is best for you? When I walk in, I want, hey, I've got PTSD. Can you do anything for me? Well, it's a slow. Can you do anything for me? Well, yes, I can. Let's sit down and do business. And people need to start asking more questions about this shit, because people are dying on a daily basis because they think, because you've heard this podcast, that the therapists there sat in front of us know exactly what we're doing, and they don't 9 times out of time, because nobody wants to ask questions anymore. Ask the question. Okay, that's my rant over. They feel better now.
Really quick, Dr. Rob, what I want to say too is that one of the things that people don't understand is that we have CEOs, we have large corporations, we have people going into work environments, and they are getting re-traumatized. These people are re-traumatizing them. And one of the things that it's so funny, because people will come to me and they want to coach and they want to change their life. And honestly, before you can change your financial life, before you can find that perfect man or perfect woman, you have to do this deep early work to find out, like you said, the attachment style. What's going on? What are you attaching to? What's the trigger? What are the cues that is going on that have you still going back to this corporation where you walk in and they re-traumatize you over and over again? And doing this deeper inner work is the thing that's going to support you in having the life that you want to live in the future.
So if we go back to what we said about the parents and stuff from the carpet, it's kind of what you're saying. We go back to the house, we're re-traumatized. We go back to the house, we don't say anything. We stick in that sick house. So when we go to work, the employment is, I said, we go back. And all we do is having a nervous breakdown. Guys, I want to tell you, we're coming to the end drastically. I've got 11 minutes before my next patient, but man, again, I think we need to book a second one in for Jeremy, because this is absolutely fascinating. And the viewers have been crazy. The viewer listings have been crazy. So I want to finish the show out, Jeremy, by saying a few things that we like to say to people that are really good and have an influence on our life, because we are running out of time any second now. But first of all, I want to say thank you for coming on the show. It's just absolutely awesome. As soon as I was on your podcast, and I got hold of my people and said, you need to get this guy on our podcast, because this guy knows what he's talking about. He's direct and he's a no-nonsense guy. So thank you for being that guy. Thank you for bringing new science into an old therapy world that wants to be dragged into the 20th century so badly, but nobody likes change. And most of all, I want to thank you for who you are. For the amount of people, because I did a lot of research on you before I came on your show, the amount of people that you serve, affect, and save is absolutely phenomenal. And we all talk about the ripple effect. I won't be surprised if you haven't actually connected with hundreds of thousands of people over the years you've been doing this. So thank you for being you, Jeremy. Thank you for being on the show. And we're going to get you back on for sure.
Yes, Jeremy.
Yeah.
You are a badass. I love the conversation. I love that you can just go right there and go right into it. The depth of knowledge that you have, it's just lovely. And what's even better about this, speaking about Facebook friends, is that you actually have been a Facebook friend of mine. And it's so nice to meet you in person. It's so nice to connect with you in this and have a deeper conversation and get to know where your heart lives. So thank you for that very much. Yeah.
Oh, thank you. We need to do a big retreat in the Bahamas after all this is over.
We have to talk about that. Yeah. We want to get a bunch of guys going over there to the Bahamas or somewhere and kind of have a new wave brain weekend or something where we can just get some real good therapy, get some real relaxation, reset the brain, realign the central nervous system, and come back a brand new person. That's what it's about, guys. Jen, you always have one question. I'd love you to ask it before we go to Jeremy.
Yes, of course. So what do you want our listeners to know? What do you want to leave them with?
This actually goes really nicely to something we didn't get to too much today. I want people to expand their mental hygiene routine to include taking care of themselves in the midst of this isolation. Right now, it's at the end of 2020. Hopefully, we're on to good things. We've got vaccines. We're going to see if we get more socialization in person. But up until this point, it's been a year of isolation. And so I want people to start noticing when their brain starts going dark places when they're alone, and just start experimenting with 15 seconds of somatic experience, not somatic experience, but somatic sort of mindfulness of what are you noticing in your body? Can you bring your attention to your breath in and out? Can you slow your breathing? Can you tell yourself, I'm safe, I'm right here, whatever I'm obsessing about for the future or ruminating about from the past, I'm going to put it aside and I'm going to center myself. I want people to really start treating their mental hygiene the way they do getting likes and shares on Facebook or Twitter. Start noticing what you feed. Start noticing what you tell yourself and allow to continue in your brain.
Yeah.
Excellent. Beautiful. Jeremy Fox was on the show, guys. Catch him on Facebook, catch him on Twitter, catch him on LinkedIn. Such an amazing guy. If you need any help, get in touch with this guy. Believe me, we personally, I'm talking about Rob Kelly Recovery Group, Recover Me Coaching, JenniferLovelyCoaching.com. We recommend this guy. And I can count on these many fingers who we recommend. But we recommend this guy. He knows what he's talking about. He's a great guy. And we're going to have some more conversations. Guys, we'll be right back. Thanks for listening after this. Hi guys, welcome back to the end of the show. My name is Dr. Rob Kelly, the Addiction Doctor, along with Jennifer Lovely. This is Recovery Channel Podcast, and we've just been listening to Jeremy Fox. And I didn't say this before, but I should have told him that I got up a little bit early today because I was excited. Isn't that crazy that he was actually on? So yeah, it was. What an amazing guy.
I think it's so awesome. I get excited too when we have guests on, and you know that we're going to have a deep dive into a deeper conversation. And you know me, I don't like to do the surface stuff very well, so I like to go right into the deep shit. And just why not? I mean, we only live once. Why not just go right there and talk about it? So it was lovely meeting Jeremy. He was amazing, and he's very knowledgeable. I love the conversation.
And you know, I think he's the man for our teens. I think he's the man for the generation coming up now, because you know, people relate to him. He looks like a fucking rock star to begin with.
Yeah.
I mean, and he's you know, all the peeps love him because of who he is and how he dresses and stuff. So I think he's gonna have a big impact. Awesome stuff. Awesome stuff. Anything coming up, Jen, that we need to know about?
Yes. So you guys, we have a free, no cost workshop. It's actually a form of narrative therapy. It's Reimagine You, the magic of you. It's a journaling, journaling 2-hour workshop. It is amazing. I've taken it before, and it really allows you to dive deep into what you're curious about, what you need permission in your life for. And that really is about us giving ourselves permission and about what our future is. And so it's not goal orientated, like we're making goals for 2021. I actually don't believe in making goals, but it's actually diving deeper into how you're feeling and stepping into getting past our fears and imagining a new way of being. So join us January 3rd at 11 a.m. Central Standard Time. So that's Central Standard Time on January 3rd. That's Sunday at 11. Go to www.recovermecoaching.com, and all you have to do is sign up, meaning you just put in your name and your email, and I will send you the Zoom link. That is yes.
Excellent. Free, guys. Free. You know, this is what we're all about, giving back to the public and our community. Guys, we've run out of time. We've both got 3 minutes, me and Jen, before we jump on to our next patient. I want to thank Jeremy Fox for coming on the show. Amazing guy. I want to thank all the viewers and, of course, after tonight, all the listeners for tuning into us. We'll have another great guest at the end of the week, I think Friday. But for now, guys, for me, I want to say thank you so much. Thank you, Jeremy Fox. Thank you for watching, and have a great day, guys.
Bye.